A new variant of the COVID-19 virus is being called the worst so far by health experts. B.1.1.529 has been reported in Botswana, South Africa, as well as Hong Kong and Israel. The UK has suspended flights from 6 African countries: Botswana, Eswatini, Lesotho, Namibia, South Africa, Zimbabwe. London had recently lifted most African countries from its red list of people who would have to quarantine on arrival. Singapore and Israel have also announced travel restrictions. Scientists say the new variant has twice as many of the mutations displayed by the Delta variant, which caused a spike in cases in most of the world earlier this year. South Africa has been the hardest hit by the pandemic of all nations on the continent. It saw a huge spike in July, with more than 20,000 cases a day at one point. Earlier this month, the daily number of infections was increasing by under 300 patients. With the new variant, that has jumped to over 1,200.
From the experience of the last 21 months or so, we almost can predict how this is going to move. As I've said, especially when, like the Delta starting in Gauteng, you can be rest assured as people start to move even more over the next few weeks, this will be all over.
The World Health Organization has called an emergency meeting Friday to discuss the situation. It will likely issue guidelines for stopping the new variant spread, which could include further travel restrictions. One health official in South Africa told reporters they couldn't see this coming. "This variant did surprise us. It has a big jump on evolution, many more mutations than we expected." The number of mutations can mean that the virus, in its new form, could make vaccines ineffective. "They give us concern this virus might have enhanced transmissibility, enhanced ability to spread from person to person, but might also be able to get around parts of the immune system." Vaccination rates in South Africa have been falling short of the government's stated goals. They are being administered at 130,000 per day versus a 300,000 per day recommendation. ADN TV will continue to report on public health developments throughout Africa and across the globe.